It's been a
Two,
stressful day.
one. Welcome back to another episode of AT Talks. This is Tom Barkowski. This is episode 3 on returning to sports. We have 4 guest speakers today. Can you very quickly introduce yourself and what setting you're in? I would appreciate it.
I'm Kim Barbara Foss, work at Cincinnati Children's Hospital, and I work at a secondary school setting.
I'm Tania McKinney. I work at Abilene Bone and Joint, full-time in the clinic, and then I contract to a small 2A high school locally.
I'm Ashley Armbruster. I work at Texas A&M Corpus Christi, which is a Division I FCS school.
I am Leah Dorn. I work with Vibrant Care in the industrial setting, and then I also do some per diem high school work.
So the last time I was at my high school, it was March 13th, and then we closed, and the school's been closed since then, but we're opening up in a couple weeks, and we're going to try to have practices, but the world is not the same as it was.
It's a fact.
Any thoughts on opening up and going back to the high school, the college, sports in general?
I am cautiously optimistic that we will make this happen to the best of our ability.
We haven't heard anything back yet as far as opening anything up or starting anything. So I know here locally we're still kind of up in the air. Like I've gotten no guidance from the schools or from UIL or anything as far as if we're going to start in July, are they going to be able to do spring or summer practices, or we just go as normal in August. So it's still kind of all in limbo.
Yeah, I'll let you go.
Oh, I don't know. I'm very cautious about it because I feel like we want to open up the economy, but we also don't want to face the potential aftermath of a secondary spread. So.
Yeah, I guess with me, I really want to be optimistic, but then we've had conference meetings and stuff and kind of trying to figure out, because the difference from the college to the high school setting is that in college, we have kids coming in from all over the country. So we have kids coming in from Colorado. That was a hot spot for a while. We have kids coming in from California, which California just made that big announcement about their state schools. And LA County extended their stay-at-home orders for another 3 months. So I know that there's a lot of questions from the collegiate level and NCAA level on okay, well, can this part of the country have practices and hold everything and open everything up when other places are still completely shut down? So does that create an unfair advantage, which I said is specifically for the college level. And then another thing that I'm honestly worried about is I feel okay, I guess not worried, but I just see that this will increase our job load a lot, because who are going to be the people responsible for screening athletes and making sure that they're healthy enough to come back to school or to participate in practices? We're going to be the ones doing that. So I know I've seen a lot of different places and they're doing their phase 1, schools and MLS and all the organizations are doing their phase 1, 2, and 3. And part of it is the athletes have to fill out a survey every single morning on do they have a fever? Do they have a cough? Blah, blah, blah. And then when they get in, as soon as they get to the facility, they have to get their temperature checked. They have to do all these other things before they're even allowed to practice. And I just see a lot of that is going to fall on us. And I know that it seems overwhelming with me, I'll have 30 kids in the fall on my soccer team. So I was thinking about it the other day. I'm oh my gosh, how would they even do that at the high school level? Because would you literally have to temperature check everyone before they go out to football practice? Depending on what size school you're at, that could be 300 people if you're at a 6A Texas high school. So I think that this is a really good chance for athletic trainers to show our worth and show all the difficult situations that we have to be in. But it's just, and nobody's ever been through this before. So I guess that's the scary part is I know that a lot of schools, we had kind of a pandemic plan in place for our like institution, which was mainly like the whole going online with classes thing. But the whole return thing is just, and it's really frustrating when you feel the external pressures from like the government wants to open back up because for economical reasons, and like college football plays a huge part in that. My school doesn't have football, so we're not really dealing with that kind of pressure. But there's a lot of people talking about like, well, if football season doesn't happen, like I just saw the other day, like a D2 will cut their football program because like they're anticipating all the revenue that they're going to lose from fall enrollment and everything. So yeah, it's going to be a really interesting, and just all the information is evolving so fast. And I think that's also what makes it hard to keep up with.
Yeah, I really wonder how these elementary schools, middle schools, and high schools are going to do it. 'Cause, you know, if it's 6 a.m. and you got all your bus drivers going to get on their buses, you know, is someone going to be there to test them? And then it's going to be 7 a.m. and you're going to have picking up hundreds of kids. You're going to take them all to the school and they all get tested there. And if a kid has a temp or has a symptom, you put them back on the bus and drive them home. Like what's the plan? I don't think we'll be testing. I think they'll have to do that in the beginning of school. And if you pass, you can go to school. But we know that there's a lot of asymptomatic people. So someone's going to have it. They just won't be having symptoms. But then is that going to just rapid fire go through your whole school or your whole football team, your whole soccer program? Like,
You know, another interesting point that we're bringing with it. Sorry, I don't know why I'm echoing. Another interesting point with that is the amount of personal protective equipment that we're going to need. With how limited supplies are already, how are we going to get more of them to do all these preventative screens?
Well, and even just stuff like getting thermometers and getting like, not even just gloves and everything. Like, I know a lot of places are moving to where they have like the forehead scan thermometers so that you're not dealing with as much like opening the mouth and like exposing yourself. But then it's like all of those are also becoming really rare to find. So, and not, I mean, I know our school doesn't have any of those. Like we just have the oral thermometer. So, so yeah, so getting a hold of all those, and you have to have all that equipment in place before students actually come back. So it's not like you can get it, like, I know a lot of us, like our financial periods start like August 1. So like we're in kind of like the middle of football and that's when we start like receiving our things. Well, it can't be that way. So, and then it's also going to get interesting with, but a lot of budgets are being cut. So we're having to cut back on things. So then like, how are you trying to balance out the things that you need versus, okay, now these are all the extra expenses that we need to help kind of cover this.
well, think about like in the secondary program, all those kids are going to come in that medical facility in that 30 minutes time frame.
Yeah.
So is it one at a time? You come in, oh, you need your ankle taped? Okay, let me clean the table, jump on the table, put gloves on, tape an ankle, throw the gloves away, clean the table. Next kid, come on in. You know, like, because that's not feasible.
Yeah, it's like right now, I mean, I've been trying to think and like, I don't even know, like trying to figure out, I've been trying to, different scenarios and different stuff. And, we're already with things in a normal situation, we're already time pressed and we're already, have all these expectations that we have to meet on a daily basis with our coaches and the admin and everybody else. And then, now they're going to throw, we're going to have all of that on top of it. I mean, there's some days that, when you plan out for 30 minutes to tape ankles and you have, 5 extra kids that came in because they're sore, and then that just throws the whole thing off. Well, now, it's like, how much time do you allot, for that? And the other thing is, is like, are we doing the screenings? Or the school nurses doing the screenings? Do we give them a questionnaire and, if you answer yes to any of these questions, you don't even come in? Do we do just a paper screening? And rely on them to tell the truth? Yeah, it's like, especially on the limited budgets, because I'm at a, small 2A school. I mean, we got 200 kids in the high school, and not a lot of budget. And so, trying to buy those supplies and buy that extra stuff is going to be very difficult, for that school.
With
I
you
think at the
saying that, sorry.
Yeah,
Go
go
ahead.
ahead. Go ahead, Kim.
I think at the high school setting, I think we'll be secondary screeners because I think it has to really be screened at the point of entry, which then would be like a school nurse or school personnel, which I fully think that we can also insist with that. But I think they'd have to be screened there, or even like Thomas brought up, screened on the bus before they even get onto the bus. Otherwise, they're bringing it with them along with everybody else on the bus to the school. I think all this, the screening, talking about the athletics, is all secondary to the screening that has to be done in the school scenario itself. I think those are all the first priorities, and planning for athletic screening would be secondary to after we figure out how we're going to take care of these kids and screen them in terms of just a normal school day.
Yeah, I guess, oh, sorry, my cat jumped up. I guess that's like kind of what I like secondarily meant is because even like at a big 5A or 6A school, I mean, you only have 1 or 2 school nurses who are then responsible for, like, are they responsible by themselves for screening 1,500 kids like when they arrive on campus? Like, I think athletic trainers are also going to get pulled into that. And I'm not sure, like, if they would get administration involved in some of that as well. Like, then you got to figure out, well, do you want to like have an online questionnaire that like the kids fill out on their phone before they get on the bus, or do you want to do a paper screening? Or like, because there's such like varieties in the resources that are available to the students as it is, whether all of them have cell phones or whether all of them have internet at home and stuff like that. So I mean, there's a lot, yeah, like you guys said, like there's a lot to work through before we even get to athletics, and that's the hard part.
I'm a little concerned with the idea of like the paper screenings or like the electronic screenings, just because like we all know that patient reported outcomes are usually either under exaggerated or over exaggerated. And the idea of a student athlete, particularly at the collegiate level, when they're already pressed, they have 4 years to make a difference. They have 4 years of time to participate, to potentially jeopardize, a whole month of their season because they said yes to something. Like they said yes to having a fever. And then they end up like not even developing coronavirus. But I'd be concerned with the validity of it, I guess.
Yeah, and I think
Go ahead.
I've talked
I kind of
enough.
tie into that because fever's been this forefront of what they're doing all the screening for. Yet is fever really the prime indicator, even if you are symptomatic? I mean, a lot of people testing positive never developed a fever. Is that really the prime symptom that we really need to worry about?
I think they're just, I guess my take on it is they're focusing on the fever because that's like the only objective symptom that you can actually tell. Like anybody can lie about whether they had a cough or whether they had contact with someone or anything, but like I feel like out of the whole list of symptoms, like fever is probably the most objective that like you can actually check and see if they have. So I think that's just like, I'm not a fan of like stores and restaurants like screening for temps before people enter and all that, because the fever is not a very reliable symptom. But I think that's just a way to say that they're at least checking something objectively versus just asking a person like, do they have this or this? So, and I think that also ties in with like what the testing and like what the antibody testing is going to be like, because if you're able to like, if someone does have a fever and you're able to send them that day and get tested, okay, it's negative, you can come back, like that'll all be great. But the problem is like right now in a lot of these places, like a lot of places around the country, like they don't have that. And the testing capabilities are getting better. Like I know in my area they've gotten a lot better, but they're still not where they need to be in order for us to use that or to rely
When
on.
I work at a small inner city school, if I have someone with a fever, I would literally have to be the person that would take them to get an antibody tested anyways, because it would be challenging to have, a parent even take them.
Yeah.
So I'd have to take the time out to go take them in to get tested.
Or trying to send them back home when, parents will go to work, or they turn around and come back and pick them up, and some of those kids, that's, parents work, we look, or my high school's out in the country. And so, a lot of those parents work 45 minutes, hour away at least, from the school, because it's in the middle of nowhere. So if they're not on the farm, working near, then they're, working in the next town over. Which, even if they're, if they're in the nurse's office puking, they still got to figure out how to come pick them up.
Let's move the time frame up. Instead of being when we're back in school, like summer conditioning, summer practices, where, my school wants to go July 1st. They want to open up the facilities and start practicing. So then in that situation, I'm the frontline person. So, there's not going to be any policies in place by the district for most districts by then. So it's like,
Yeah.
you just make it up as you go, and that kid has a cough, go home.
Well, what about sanitation of those facilities as well? I know most like custodial systems are done when school's done. Like they don't come in over the weekends when we have tournaments there, or they're not really coming in to clean up. Like you have to clean up after yourselves. So who's doing that? Who's supplying that, like the cleaning supplies? And like, how is that going to work?
And what happens if one kid gets sick and they get tested and they're positive? Whole school closed, whole program's done, all sports done. And it's,
Yeah, I mean that's especially the smaller schools. I mean, I can see that them doing that because they're all, there's in each class has about 40 kids, so those kids are all together all the time anyway.
Mm-hmm.
And so one of them comes down with it, then I can see him shutting down the whole place.
And maybe now is the perfect time that I think that a lot of the health departments should also be training tracers. I think that's a huge area, even where athletic trainers can be involved in as well.
Yes.
Especially once we get back to our settings, being trained in how to trace back and track exposures, because I think that's going to be fundamental. And I think it's a piece that's really getting overlooked right now in how we're preparing for it. Because say if you, like a college campus, when you have a lot of students, a lot of buildings, you have somebody that tests positive, if you're able to actually trace and track back exposures, you may not have to shut down an entire campus. You can be able to better identify affected people. So I think that's really an area that is being overlooked right now, and getting tracers in place. I know like in Ohio, our governor put out a call for volunteers and paid people to act as tracers within the state. And I think that's really what we need to start focusing on. I think that's a great role that we can do as well.
Yeah.
That's an interesting perspective. And the question that jumps in my head when you say that is, how would we, I think at the high school it might be a little bit easier than at a collegiate setting. How do you quarantine all those people? If you go back and trace, Ashley, one of your soccer girls, and she was in a classroom with 20 people here in a classroom with 15 people here, and she sat right next to this person, or going back and tracing them.
Yeah, she lives in that dorm.
Well, and here's also the problem is all the student athletes typically live with their teammates. So then it's if one person tests positive, okay, we probably have an entire room of 4, and this room of 4 always hangs out with this room of 4 and hangs out with these people on these other teams.
Or there's a communal kitchen or something.
Yeah, so I know that our student health center is, I believe that's part of their response plan that they're developing, is trying to figure out what the quarantine procedures would be. So I'm just speaking anecdotally. I would think that they're probably going to section off part of the dorms and use those specifically for quarantine.
But do you have that much housing available? With some schools, they have, I know that they have overflow housing. They also have a lower retention rate or whatever and whatnot. Yeah. But what about schools that are impacted?
Well, and I think another part of that is also we're looking at potentially how many students that we're going to lose just in general. Because I know a lot of schools, that's like, if they're not able to attend classes or they don't feel safe attending classes, okay, well, I'm just going to take classes at the community college down the road and stay at home so I can save money. And so I know that's like a huge budget thing that college athletics is looking at, is losing all the money that comes just from enrollment. So, I mean, I know some schools were projecting even like a 10% loss on student enrollment for the fall, which would be huge. So then there like potentially might be that much housing opening up on campus. But yeah, there's a lot to figure out.
Yeah.
Another
That would be-
concern. Go ahead. Go on. Yeah, that's fine. Keep do your thing.
Oh, no, you're fine. I was saying,
Another concern I have is that you're going to have all these schools. Well, you know, before going into this, what, like 60% of schools either don't have, secondary schools don't have an athletic trainer or have a part-time, and then you just either fired or furloughed a ton of people. So are you even going to have the staff? And you can't just hire a new grad athletic trainer because none of them are taking the VOC. It's like if you're a hospital system like I'm in and we have 30 athletic trainers, like, are we going to have 30 people to work all those schools?
See, I view this as the perfect opportunity for each county, state, Department of Health to step in and say, in order to have athletic institution, you have to have somebody that is trained to manage infection control. And hey, that perfect person is an athletic trainer. I think this pandemic aligns us to actually help really promote our profession and the worth that we have as being, you know, we take care of these athletic injuries, but guess what? We're healthcare providers and we can be your first line of defense in infection control. So maybe we start approaching health departments and say, we're your go-to person. You know, schools that want to have athletics and they don't currently have somebody in place, a coach cannot do this. They're not trained. We are. Maybe this needs to be mandated from the health department that an athletic trainer needs to be employed in these settings. Otherwise, it's a safety violation.
Yeah.
Tania?
And I honestly think I'm
Hold
hoping
on.
that that's going to be a huge push in the coming months. I know like right now with a lot of athletic trainers being furloughed and all that, the big push on like athletic training in the NATA is that like we're able to help out in the ICUs. We're able to help out at hospitals. Like we are being a lot more seen as healthcare providers rather than just someone who stands on the sideline and takes care of injuries.
And absolutely.
So I really hope
all the pictures that they've been posting.
Yeah, no, it's been awesome.
I mean, it's perfect because it's very strategic, because now there is this public record and presence of athletic trainers in protective equipment dealing front line with this. So now people are able to see us in that role. So the fact that they've been accumulating all these pictures and promoting them and putting us out there as a face of a frontline provider was a great strategic move in really aligning athletic trainers as healthcare providers.
Yeah.
Tania, what did you want to say?
I don't remember what I was going to say.
No, Tania was going to say something. Her and Kim went at like the same time.
Sorry.
Yeah. Well, at the school that I'm at, so we've got a lot in the Abilene area. We're kind of centrally located, and then we've got a lot of small schools around us. So all of the big schools in town all have their own dedicated athletic trainers, but these small rural schools are the ones that we cover. And we typically are only game coverage. And so while I've been at the school I've been at the same school for 15 years. And I, know the community and part of the community and stuff. I'm still only at the school, on game days. And so, that's, coming back to that 60%, so that's leaving it on coaches and leaving it on, principals, and, they've got one school nurse for the entire 2A, the school, not just the high school, but the ISD.
The district, yeah.
Right. And, so logistically for these smaller, of course, I think in that county I think they've had 2 positive cases in the county, that school is in. So their exposure is not near as high as some of the city schools, but they're still, it just takes one, so,
Yeah, it's like you said
these
earlier, like
smaller,
you could see that one case would potentially close down the school. And those
right,
rural schools and those smaller schools are going to be the ones that are going to have I feel like have the hardest time adjusting to
right,
all this.
Well, especially if your state is just very like. So I'm in Indiana, and we're opening up. You can go to restaurants and sit down and stuff. But if I go 3 miles west, I'm in Illinois, and they're lockdown. So it's like if that school gets a case, those fall sports over, in my opinion.
yeah.
Mhm.
Well, that's like, they've started opening stuff up here, in Texas,
Mhm.
and we're all just kind of sitting and waiting to see what's going to happen. Is it going to, are we going to have that second, that second surge, or are we going to, ride this one out, and, hopefully everybody's, doing everything that they're supposed to be doing. And, but it's the same mantra with any other virus that's out there. If you're sick, stay home, and the part about, the COVID is that what's different from the other viruses is that the incubation period of not having any symptoms is so much longer, than the other ones. And so, yeah, I mean, yeah, like I said, I just, I kind of feel for my school, because it's like, yeah, we want to get going, and everybody wants to start and start back up, but then, there's nobody there on a regular basis. And so I don't know what we're going to do.
Yeah, and I think it's good that a lot of athletic trainers are having these conversations, but you're gonna have to have these conversations with the district nurses and with
Hmm.
the athletic directors and the school boards. 'Cause it's like if you don't have any kind of plan besides just thoughts in your head, and then all of a sudden you're on a football field for a practice, like this is could get very bad very quickly.
Yeah. So I think, I think, was that me echoing? I think, I think right now, especially for, like I said, for our smaller schools, like where I'm at, where I contract out, and so I'm not on campus on a regular basis. Right now is the time that that we contact those ADs, and we reach out to them, as far as, okay, have we started thinking about the fall? We started thinking about what, these processes are. Do y'all need more help? Do y'all need us to be there for more than just games? Do we need to be, and start trying to push, for that. But I know trying to get mine to contract to, for them to pay for me to cover away games, as well as, for, some other than football. I mean, I go for away for varsity football, but, getting them to extend the contract to include other sports has been at times like pulling teeth. And so, getting them to extend the contract to cover practices and to cover, to be there more, is going to be difficult.
Well, we have just over 2.5 minutes. So, any other things anyone wants to say? Anything that popped up on your brain? Any thoughts? Any concerns? Any potential barriers?
I think there's quite a few barriers, but I also think we're good at overcoming barriers. I mean, we tend to be a reactive profession where if the situation arises, we react to it. But I think now is the perfect time we really need to evolve and be proactive. We're great with developing EAPs, policies, and procedures. And I think this is just something that we need to literally think about and start having those discussions now with all the different stakeholders that are going to be involved, so that it's not July 1st or August 1st and camps are starting and then we start the discussions then. I really think we need to start, this is going to be here for a while. We are going to have a second surge. It's just a matter of prevalence and exposure. I mean, we know it's going to happen. It's not like it's just going to disappear. The extent of which we don't know, but it's going to happen. And how do we best handle and manage that? I think now is the time to kind of be proactive and try to get as many measures into place as we can in preparation.
Yeah, I don't even know how like down there in Texas, if you got a football team of 300 kids and Friday night you bring in 10, 15,000 fans,
Right.
like it's just,
Yeah.
and you're gonna say, hey, football's canceled this year. That
Yeah.
those cities, those people they're gonna lose.
Or like even how well is it going to go over if you say, okay, we're going to have football games but no fans?
Yeah.
That's not
Our
going to go
entire
over very
town-
well.
The entire town shuts down on Friday nights, and they're all at the game, like the whole place.
Yeah.
Well, we have less than a minute, so any second we'll get kicked out of this because I don't pay for this because I'm cheap and poor. I'm sorry. Thank you. Thank you for coming on and talking about returning to sports. And then hopefully I see you in 30 minutes in the Wolfpack tonight.
Sounds good.
All right.
Have a good one.
Thanks, Tom.
Bye-bye.